One thing that I've learned is that the symptom and the thing that perpetuates almost every mental health challenge that people have is avoidance. If magically we were able, and I'll include myself in this, just in life in general, if we were able to stop avoiding uncomfortable conversations, avoiding uncomfortable feelings, and avoiding things that are hard or things that seem hard, how much easier would life be for us?
Welcome to the Type 1 and Midlife Podcast. My name is Melissa Slemp, a certified nutritional health coach and the founder and CEO of Abundant Health with Melissa, where I help women with type 1 diabetes to feel more empowered and live their best life despite their diagnosis. Each week, I will bring conversations and strategies from guest experts and my experience living with type 1 for over 40 years now. So if you're a woman ready to redefine how diabetes can look and feel for you, then the Type 1 and Midlife Podcast is the show for you. In today's episode, we welcome Dr. Mark Heyman. He is a diabetes psychologist and a certified diabetes care and education specialist. And he is the author of Diabetes Sucks and You Can Handle It, your guide to managing the emotional challenges of T1D. And Mark has been living with type 1 since 1999. He comes in and shares his own diagnosis story and helps us better understand our fears of lows and the pressures of adults diagnosed and their adjustments navigating life before diabetes and now after diabetes. And we talk about all the struggles, the ups and downs, living with type 1, and how it's even different for men and women, and recognizing that diabetes is hard and the importance of seeing yourself succeed is really, really the important part. And he explains his lead with action framework that helps his patients flip the script. So listen in and please share your feedback about this important conversation with Dr. Mark Heyman. Just a reminder that nothing you hear on this Type 1 and Midlife podcast should be a substitute for professional medical advice. Please always consult your medical professional before changing your diet, insulin dosages, or healthcare plan. Well, hello and welcome. This is Melissa, Type 1 in Midlife, and I am joined today by Dr. Mark Heyman, and I'm just very, very honored to get a chance to speak with you, Mark, get to know you a little better and your practices with your patients. And just a short recap, you are a diabetes psychologist and certified diabetes care and education specialist and the CEO of the Center for Diabetes and Mental Health, and you are located in San Diego, beautiful San Diego, and you are passionate about providing diabetes education and evidence-based mental health treatment and online programs for those of us living with diabetes. And you also live with type 1, so since 1999, so that's 24 years, is that?
It'll be 24 years in about a week and a half. So,
yeah. Wow, your anniversary is coming up. Well, say hello, and we'd like to learn a little bit more about you. I know you're obviously busy in this space. You do your own podcast, and I don't know how much opportunity you have to share your own story, diagnosis story. Share as little or as much as you want, just so we get to know you better as not only as a doctor, but as somebody living with type 1.
Of course. So I was diagnosed with type 1 diabetes on June the 1st, 1999. It was the end of my third year of college. So I wish, Melissa, that I could tell you how long I had symptoms for, but as you know, or maybe as it's been a long time for me. I know that for sure. It was the end of the year, and so I was busy with finals and trying to finish all things up. And so I remember getting up and peeing every couple hours. I remember being very tired, but I assume that was just related to finals week and just trying to get through the end of the school year. But I was going to school in Los Angeles from UCLA, and I came home to San Diego for the weekend, for Memorial Day weekend. And I remember getting off the train and my parents picking me up from the train station, took me to a restaurant, pizza restaurant we've been going to for years. And we sat down, the four of us did, and there were 4 glasses of water on the table. And I drank all 4 of them. And I was so thirsty that I couldn't wait for the waiter to come back and get, excuse me, refill the water glass. So I got up myself and found the water jug and refilled them myself. And my mom looked at me and she's like, "What is wrong with you?" And so I was really thirsty. It's like, "You need to go to the doctor." I'm like, "Nah, I'm fine." So long story short, went back to school on Monday. Tuesday morning, got up and walked to class, and I couldn't make it. And I was like, I have to go to the doctor. So I ended up going to the student health center, and they sent me to the emergency room. And long story short, I was diagnosed with diabetes. There's a twist here, though, because I was one of the reasons why I was so resistant to my mom saying that I need to go to the doctor, and knowing in my mind that I really did, was that I had a trip planned to France for the summer, about leaving in the middle of June. I think it was like June 18th. I was supposed to leave. And I was so terrified that if I got sick and I was diagnosed with something, whatever it was, I had no idea it was diabetes, that they would tell me that I couldn't go to France. And so the day after my diagnosis, I went to see my endocrinologist for the first time. And, she gave me kind of the rundown. She spent 2 or 3 hours with me. She spent a long time with me. And at the end of our cram session, she said to me, "Any questions?" And I said, "Well, yeah, I do have one question. I'm planning to go to France for the summer in a couple of weeks. I guess that trip is off." And she looked at me. She's like, "I was crazy." She's like, "Why would you cancel that trip? Of course you can go." So I think it was 2.5 weeks after my diagnosis, I got on a plane and flew to Paris and spent the summer in France, which was,
wow.
Looking back on it, I mean, I would absolutely do it again. Looking back on it, I'm glad I didn't know what I didn't know at the time, because
right, yeah, you just rolled with it, didn't you?
Yeah. I'm like, I'll be fine.
Yeah, no problem. Yeah, and obviously it worked out just fine. So yeah, here you are. So what kind of insulin therapy and methods do you use right now? Yeah.
Right now, I use a T-Slim, the Control IQ. And I use Dexcom.
Good old Dexcom. I'll tell you what would we do without it, right?
Well, so their offices, I can see them from my desk.
Oh, really? So that's really
very close.
Interesting. So do you remember not having a CGM?
Oh, absolutely.
Isn't that funny how, like to this day, I can't remember it because I'm so hooked to it. Although, you can look back and think, "Oh my gosh, I used to have to prick my finger so many times a day." But what a blessing it is, I'll tell you, just to have it.
Yeah, I could definitely remember that. I mean, I've been using a CGM for probably 10 years now. But I used one prior to that. This was probably in 2008. And it was so awful that I swore off using a CGM forever. And it took a lot of convincing for me to actually start using the Dexcom, which I use now and have never stopped using.
Never looked back.
But I remember, I mean, for a good 12, 15 years after my diagnosis, we didn't have CGM. So pricking our finger, and I mean, at that time I was waiting a minute for a reading. So if you didn't get the reading in a minute, you have to get an error message up, do it all over again, and it's a time-consuming process.
I know it's just so much to be grateful for. I tell you, the tools and the technology, the different types of insulins, we are very, very fortunate. Although we have all these physical tools, there's still, the foundation, I think, of everything in life, and especially our health, is really our mindset and our, it's that day-to-day stability, confidence, lack of stress, all the things that you've wrote books about this, so you know better than I do. But without that solid foundation, we suffer, and especially, people suffer in general without a chronic disease. But, it's so cumulative when we're living with something that we can't take a day off from, and it surmounts. And, so what are you seeing? Is there like a number one stressor? And I know there's probably a lot of layers to why people come to you. What triggers are happening? Maybe it's, again, you can explain this a lot better than I can, the words, but is there a number one stressor or trigger that is leading to them having to come and to get your help?
Yeah, so I think there are two big ones that I'm seeing more and more recently. The first is fear of low blood sugar,
Fear of
and
lows.
this is something that people deal with a lot, and we don't talk about it enough. I think that fear of low blood sugar is really prevalent in the type 1 community, and it really can be debilitating.
Yeah.
People worried about having low blood sugar, and so they keep their blood sugars high. They don't feel well. And then they also avoid activities that they really want to be able to do, but they feel that if I do this activity, well, I feel if I do the activity and I go low, it's going to be big trouble, or this activity is going to send me low, and so I'm not going to do it. It's kind of it goes both ways. So that is one of the biggest issues that we see, that I see in my work. The other one is I think is a little bit more recent, is seeing people who are diagnosed with diabetes as adults. And really trying to deal with wrapping their head around what that means, because I was diagnosed when I was 21, so I definitely remember life without diabetes, but it's far enough past right now where it doesn't really bother me a whole lot. But for some people who are diagnosed, as adults, especially recently, they remember recent life without diabetes. And so trying to figure out, like, what does this mean about me? What does this mean about my life? How do I make sense of this? How do I mourn the loss of my life before diabetes and accept the life that I have right now with diabetes? That can be really challenging for people.
It's funny you bring that up, because I'm seeing a trend as that as well. A lot of the women that are finding me, whether it's online or just coming to me as a coach, yes, it's no longer just it used to be juvenile. I was diagnosed at 14, so I was very standard, right? I was the typical. But we're seeing all ages. There doesn't seem to be, and that does strike me. I'm seeing, just like you say, they are different ages are more distressed based on suddenly they have something it's really interrupting their life. And it is easier. Maybe it was easier for myself. I feel like I've always had it. I remember it as a kid, not having to obviously test my blood sugar, but it's such a lifetime of it that it does get easier over time. And then, like you say, when you're not, when you're not already in adult stage of life and having to deal with adult responsibilities along with it.
Right.
So there's so many layers to it, isn't it?
Absolutely.
That's interesting. Yeah, that's something. So have you yourself, and you can say this if you'd like to, but this is, I'm curious, do you experience any sort of the same things that you help people with?
Well, I don't experience, I'm very lucky that I don't have a fear of low blood sugar. But, anyone living with diabetes is going to have negative emotions. It's frustrating sometimes.
Right.
Last night, my blood sugar was over 400, and I have no idea why. Like, I woke up in the middle of the night and I couldn't figure it out, because my pump seemed to be working before I went to bed, and there was no reason why it shouldn't have been working while I was asleep. But I mean, those types of things are frustrating. And so I think that everyone living with diabetes has those types of challenges. I'm very lucky that I haven't had any major events in my life, any severe lows recently. It's been more than 10 years since those have happened. And so, but certainly those experiences are scary, and, trying to kind of recover from them, make sense of them can be challenging. And so yes, I had definitely experienced the ups and downs of diabetes throughout my life. And right now I experience the normal frustrations and the, impatience and all the things that we all experience on a regular basis. But I will tell you that right now, I'm not in a place of burnout, and I'm not in a place of fear of lows. I consider myself lucky for that. It's nothing to do with me. It's just kind of the cards that I've been dealt, at least at this point in my life.
Yeah, and you've been given the gift to help others. So obviously, it starts with ourselves, doesn't it?
Right.
We got to do the best with ourselves, with our own sort of journey, to better serve others. So I can definitely see that. I'll share a short story with me, or just a kind of a shorter version. When I was diagnosed at 14, it was in 1982. So I didn't even have a glucometer back then. So for 10 years, I was literally, and this is kind of a pun to the story, I was kind of flying blind with my diabetes. So I was almost 25, 10 years in, and just newly married, diabetic retinopathy. So I went to the eye doctor for the first time, realized that I had bleeding eye vessels.
told if I didn't figure it out that I could go blind. And guess what that did to me? Obviously, I got my glucometer out and got myself straight, but that's where the extreme tight control took over my life, because I was walking around with, I don't want to go blind.
Right.
And so it's, because either parameter, either trigger, whatever that term is, can really lead to not good choices, and how we function every day. Because I know that's what you're experiencing with your patients too. So that's just, and luckily it took me a while to kind of just relax into that, and just to really have faith about it. I knew that I was doing the best I could. The doctor's visits every year were getting okay. My eyes were stable. They were healed. So there was conviction with that what I was doing was good enough that I could relax and just kind of let it go. But it took time. I will tell you, it takes time just to let go of that.
Well, and look at the messaging that you were getting. Your doctor said, you better figure it out. It's not my responsibility, it's yours.
Fear.
And I mean, certainly, you have a responsibility there because you're living with it on a day-to-day basis, but you need support from your doctor. And I think kind of kicking the ball into your court and saying, you need to do this. My hands are clean. That doesn't sit well with me.
Yes. It wasn't good care back in those days, was it? For sure. Yeah, I totally agree. So what are the stats about men versus women when it comes to the emotional challenges? And the reason I asked this too, because we all, because obviously you're a man with type 1. I'm married to a man with type 1. How about that? There's a low stat, right? There's not too many statistics that show 2 type 1s being married. But is there a statistic that there's more men versus women coming to you? And does it look and come across differently or demonstrate differently?
So actually right now, of the patients that I see, about half are men and half are women. Which actually surprises me. When I looked at that recently, I was actually a little bit surprised. I mean, I should know this because I see these people on a regular basis, but because if you look at, for example, the diabetes online community, on Instagram or on Facebook, it's mostly women. And so it's interesting to me that there are, proportionally more men coming to therapy and coming to seek treatment, possibly because it is confidential and there's no one seeing that information. Partially because I think I'm a man and that they can probably relate to me.
That's true.
But it actually does surprise me. I look at I have a fairly large email list of people with type 1 diabetes, and I think it's like 80% women. So it's really skewed. But the patients that I see in my office or online, it's less so.
That's interesting. And so are the triggers, the kind of the background reasons why they're there seeking your help? Is it similar for men and women?
For a lot of them, it is. Yeah, a lot of similarities. I think that you see more anger, because with variable blood sugars. So when their blood sugar is high, they express that through irritability and anger much more than women do. And I see that quite a bit. But then also just trying to fit in, how do I feel like I'm a normal person, especially younger men who are dating and wanting to feel like they are strong. The diabetes can make that challenging.
Yeah, it sure does. And society does it. Sometimes we put that on ourselves, that we're, that there's a weakness, that we're handicapped, there's things we can't do, or all those things, right? Those stigmas. Yeah. So I can understand, especially that time in their life where they're questioning who they are and, really what their future can look like. So you have a lead with action framework. Does that sound familiar? I'm sure it does. Yeah. And it struck me. Could you explain that to the listeners and give an example of, and maybe explain it first, and then maybe giving an example of someone that has gone through this framework, like the before and after, because I love to hear happy endings.
Yeah, absolutely. So, I came up with this framework several years ago, because what I was seeing, I think it's something that we all see a lot, and that we all do, is that we tell ourselves, I will go for a run, or I will go skiing with my kids, or I will do whatever it is I'm going to do when I feel better, right? When I feel calm, when I feel less anxious. You fill in the blank there. And I mean, that sounds reasonable on the surface of it, and something that we say all the time. I'll do that when I have more time, right? When I have more energy. But what that's actually what the message that you're sending yourself there is that my emotions, how I feel, is in charge of my behavior. And that with diabetes, or with anything for that matter, that's not a really helpful place to be, because I don't know about you, Melissa, but I can't control my emotions. I can't control how I feel at a certain time of the day, and I can't change it. I can't change it on a whim. And so if we allow our emotions to lead us, we're going to be led in the wrong direction, and we're going to be waiting a really long time, or maybe forever, to get to where we want to be. And so the Lead with Action framework really flips that on its head. And it says, well, you can do what you want to do no matter how you feel. Is it easy? No. Is it worth it? I think so. I definitely think so. And the best story that I have about this is, it's the story that I wrote about in my book. I had a patient came to see me so many years ago, and he wanted to go on this surfing trip. He was a big surfer and wanted to go on this surfing trip to Indonesia. He had him and his friends had rented this boat in the middle of the Indian Ocean or something, and they were going to live off of it for 10 days and surf. And I'm not a surfer, but it sounds like fun. And he says, I can't go because I've already paid for it, but I can't go because I'm just so scared of low blood sugar. And I'm scared of what's going to happen to me. And so long story short, or actually short story short, he came to see me for a couple of sessions and disappeared. And I didn't really think much of it. I figured he didn't go on the trip, and I figured, I'd never see him again. So I got a call from him about a month later. He's like, can I come in and see you? I was like, sure. So he comes in and sees me, and he's like, guess what happened? I was like, what happened? He's like, I went on the trip. Oh, but that's amazing. Tell me. I was genuinely curious. Like, how did you do that? Because I really didn't think at the point that we were in the work that we were doing together that he'd be able to. He's like, well, I did exactly what you said. I carried my surfboard under one arm, and I carried my anxiety under the other arm, and I carried them both with me on the plane. Yeah. And so that's exactly it's a great example of Lead with Action, because did he feel anxious? Of course he did. Did he let that anxiety get in his way? No. And he was able to go surfing on this, sounds like an amazing trip. And his anxiety was just a friend, or at least a companion on the journey, as opposed to a barrier that kept him from going. And reframing that to say, well, it's something I live with. So whether that's diabetes, whether that's fear of lows, whether that's diabetes burnout or a complication, saying, well, I'm going to bring this with me, and it's going to be my companion, and I'm going to do everything that I can to my physical abilities. Certainly, and I'm going to do it, even though I feel I'm feeling scared or I'm feeling anxious, but I'm going to use my brain and my cognitive abilities to recognize that what I'm doing is actually perfectly safe, that my feelings are my emotions are giving me a message that may not be actually accurate, and I'm going to lead with my action as opposed to lead with my emotions.
Yeah, I love that. Yeah, because you know what? We don't know until we try, right? And the fact that, that he just has to, he just accept the fact that no matter what, I'm going to be anxious. No matter what, I'm going to be nervous. But you can't let life stop you. But so many people do, that they let diabetes get in the way out of that fear of not being able to handle what may happen, right? It's always that. Do you see that people are looking too far into the future? Because I've noticed that with some of the clients I've worked with. We've talked through this. And again, I'm no expert. I've directed a lot of them towards you and your site and your courses, just because I know that you can lead them in a more frameworked area. But just to be able to say, just like you said before, one of the things that I've tried to give help on was recognizing that you have all that you need,
Mm-hmm.
To be prepared, right? To be equipped, whatever that looks like, no matter what it is, a high, a low, or whatever. I always say it's like, you go out the door with your pens, you go out the door with your snacks, you go out the door with everything you need, whatever makes you feel comfortable.
Yeah.
Yeah. Do you see that barrier?
I think that people definitely look into the future too far. Here's the thing that I see the most, though, and it's just kind of it's a hidden thing, but I think that once people start to see it, it becomes much more clear, and that is people are scared, anxious about feeling scared, and so it's easy to say, and they believe this, at least, they say, I am really scared of my blood sugar going low. And we talk through that and really talk about the logistics of it. Okay, well, what happens if your blood sugar goes low? Well, how many times have you been unconscious? Usually, the answer is usually 0. How many times have you had glucagon used? The answer is usually 0. Gotcha. What would happen if you went low right now? What would you do? And I would get up out of my chair and walk to the kitchen and get some whatever, and treat it. So, so they know that they have the ability to handle physically the low blood sugar. But what they're really scared of is the feeling of anxiety. And so it's not, and I don't want to say that the low blood sugar is a scapegoat, but it's actually too far down the road to that. But the thing is that if you think about going low, if you think about that experience, all of a sudden the fear takes hold of you, and you don't want that. So you do whatever you can to avoid it. One thing that I've learned is that the symptom and the thing that perpetuates almost every mental health challenge that people have is avoidance. If magically we were able, and I'll include myself in this, just in life in general, if we were able to stop avoiding uncomfortable conversations, avoiding uncomfortable feelings, and avoiding things that are hard or things that seem hard, how much easier would life be for us? Right. Because avoidance, then, it not only stops us from doing things, but it also reinforces the beliefs that we have that whatever we're doing is hard, scary, anxiety provoking, you name it. And so if we can remove that avoidance instinct from people, where it's not helpful, and that's 99% of the time, then they'll be a much better place.
Gotcha. Yeah, all that makes sense, and it kind of brings up like PTSD. I know that term is associated to a lot of different experiences that people have, but I've heard it come up in the diabetes distress area as well. So, is it that remembrance of a bad experience? Is that's just something that's stuck that they can't shake? They can't let loose of that.
Well, with PTSD, there's 3 different symptom clusters. The first is avoidance, the second is re-experiencing, and the third is hypervigilance. And as you can tell, they all connect to one another, because if you're re-experiencing something, if you're having these memories or this experience that's not comfortable, of course you're going to want to avoid it, and of course you're going to be hypervigilant to make sure it doesn't happen again. And you can see how they're all connected to each other. But the same thing is true for any kind of anxiety. The same thing is true for feelings of depression. Not that that's the cause of depression, but certainly it's the thing that maintains the depression. If you think about or maintains diabetes distress, like if you don't want to deal with diabetes, and so because you're so burnt out by it, so you stop managing your diabetes, that's avoidance. And then that then your blood sugars go high. You don't feel very well, so then you feel even more burnt out. So then you avoid even more, and you can see how that behavior.
It's a vicious cycle, sure.
And I don't want us to make this sound easy, because it's not. But imagine what would happen if that person who we just talked about could manage their diabetes well for a day, keep their blood sugars in range. How much would that impact their burnout? Probably significantly, because they were leaning in as opposed to avoiding.
Yeah. And to see themselves succeed too, because I think that's what helps people in general when they're trying to reach a goal. And sometimes it's just drinking more water every day. I know that sounds silly, but it's doing those simple things. It's kind of that low hanging fruit and saying, okay, I got this. Okay, I can do that. I can do more. I can do more. I'm sure the same theory kind of applies to what you're saying. They got to see themselves doing it, right? And accomplishing and then feeling better doing it. Definitely. Now, do you see in the mental and emotional health integrating into the healthcare system, do you ever see that being part of what diabetes care should look like in the doctor's office?
I wish.
I know. That's one of our hopes and dreams.
I mean, that would be an ideal situation.
Yeah.
There are so many barriers to that happening. And I don't want to see that. I don't want to say these barriers can't be overcome, because they certainly can be. I think the first barrier is lack of providers. There's not enough people who understand diabetes well enough to actually be helpful. But the bigger barriers are, the healthcare system, like seeing the value of mental health care.
Yeah, exactly.
Oftentimes they see mental health care as the ugly stepchild. And, and that's why I do the work that I do, not with patients individually, but also, with, big, more scalable solutions, because I think that patients, at least right now, we need an alternative that doesn't involve the healthcare system for mental health care, because it's just too difficult to navigate through it to find what you need, as opposed to just going somewhere, a website, and finding what you need on your own.
Right.
I mean, the other thing I'll say is that funding is a big issue. What you'll see actually is there are quite a few children's hospitals and children's diabetes clinics in the country, in the US, that have integrated mental health services, whether it's a psychologist or a social worker. The secret about those, though, is that the majority of them are actually donor funded. And so you have a wealthy donor who says, I really want to take care of the kids with diabetes. They give $1 million for, let's call it 5 years of a mental health clinic or support in the clinic. And so there's no reimbursement challenges, because that person's time and the clinic's time is paid for already. Trying to figure out the reason why it hasn't happened in adult clinics more is because figuring out how to pay for it in a way that works is more challenging than it should be.
I know. And this is probably a topic we could do a whole episode on. Because, preventive and proactive is really the way to go, because it's going to save money in the long run, right? Insurance and all of that. So, just, working, again, we talked about that at the very beginning of the foundation, just making us stronger, more better equipped to handle anything, especially chronic disease. So nice. So tell us about your book, Diabetes Sucks and You Can Handle It. I love the title, Your Guide to Managing the Emotional Challenges of T1D. Tell us a little bit about that, and then I'll give you a chance to share. And we're going to share in the show notes too, a link where the listeners can purchase the book.
Yeah, absolutely. So I published this book last April, so it's been a little over a year now. It's been a big success. I've been extremely thrilled to hear everybody reading it and giving really positive feedback. But the purpose of the book, the way the book came about is I've been thinking about writing a book for a very long time. And a couple of years ago, a young man walked into my office, someone I know fairly well, and he sat down in a chair and he says to me, "Diabetes sucks." And my first response to him was, "But you can handle it." And then I stopped myself and I said, "No, not but, and you can handle it." Because it shouldn't be a either or. It should be, yes, these things we can hold both of these things at the same time.
Absolutely.
And so,
first step is recognizing it, saying it out loud, right?
So the first part of the book really focuses on why diabetes sucks. And it does it from a couple of different angles, reasons why it does, but also recognizing that if we don't acknowledge the fact that diabetes is really hard for everybody who lives with it, certainly there are degrees of hard, but I think if you tell me you live with diabetes and it's completely easy, you're either delusional or you're lying to me. But if we don't recognize that the real things about it are hard, we're not doing ourselves any favors, because we can't do anything to address them if we ignore them or don't acknowledge that they're there. But on the other side, how many times have everyone living with diabetes made it harder than it has to be, make it suck more than it really does. Because we can talk about all these doomsday scenarios. But for most of us, the vast majority of people with diabetes, living with diabetes, it ebbs and flows, and it's not as bad as it's not as dramatically bad as we sometimes make it out to be in our minds. And so in order to really recognize that it sucks, we have to kind of put some guardrails up on that. Yes, it sucks, and we have to recognize that, because we can't go too far to it's totally fine. But we also can't go too far to the other side where it is the worst thing that could possibly ever happen to me. My life is over, because we all know that's not the case. So then from there, we talk about, okay, now that we recognize it does suck, what do you do about it? How do you handle that? And the word handle is really important, because I think sometimes some people are reading the book looking for the way to make diabetes stress-free. And that is impossible. Diabetes is a stressor. It's going to be, you're going to have high blood sugars, you're going to have low blood sugars, you're going to have all these things happen to you. And if they don't cause you stress, I'd be worried about you. So the question is not how do we get rid of it? It's how do we live well with it? And how do we handle the stress in a way that doesn't get in the way of our lives? And that's really the goal of the book, is to empower people to embrace that and to handle the stress so that they can not let that stress get in the way of their work, their school, their relationships, their hobbies, their diabetes management.
That's nice. Yeah, I appreciate that. Yeah, and it's definitely something that everybody needs to have on their bookshelf, living with diabetes, or if you know somebody with diabetes, living with somebody with diabetes. So what's a few easy steps that our listeners can take away today to begin, just to begin to reset their own mindset? Is there easy steps or simple steps?
Yeah. I mean, I don't know if there's any easier, simple steps, but there's certainly some things that you can do. The first is to be honest with yourself about what is challenging about diabetes. And so that, because that allows, and really you might I would recommend making a list of those things and then picking the thing that's at the top. Because what we know is if you pick the most challenging thing to focus on and to address or handle, there's usually a trickle-down effect to the other challenges. If you pick the easiest thing, the effect doesn't usually work the other way. So that's number one. Number two is, if you're experiencing anxiety or depression or distress or whatever it is you're experiencing diabetes, I want you to track it. I want you to track it on a regular basis. I mean, here's why. We've all had those amazing blood sugar days where you look at your CGM graph and it's flat. They don't happen very often, for me at least, but you have them. But if you actually, and so you say, my blood sugars have been 110 all day long. Well, that's actually not true. If you actually take your finger and take it over your phone, you'll see that your blood sugar goes up to 115 and down to 95 and up, but it looks flat. And so, and with the same thing happens with our burnout, with our anxiety. It changes on a regular basis. It could change within 5 or 10 minutes. But the changes may be so small that we don't notice them. But here's the problem. We get in the habit of saying, I am always burned out. Okay. And if you're always burned out, then what does that do? What does that language do? It says things are never going to change for me because this is just how it always is. Yeah. But if you're able to see that your burnout goes up and down, it changes a little bit at a time, that gives you some hope, even if it's going down, because it shows you that things can change. And that loosens your mind. You see, wow, well, yes, I'm feeling burnt out today, but that doesn't mean I'm going to feel burnt out tomorrow, or maybe I'll feel less burnt out tomorrow. And that can give you a lot of hope. And the third thing is, I would really encourage people to remember that they are more than a person with diabetes. They are a mother, a father, a sister, a brother. They are an employee. They're a friend. They're a competitive ice skater, whatever you are. And keep that at the top of your mind, because so often we can just say diabetes is taking over my life. And if we're able to see ourselves, well, but it doesn't take over my life when I'm having dinner with my family. It doesn't take over my life when I'm on a walk with my wife. When you have that perspective and say, yes, it's part of my life, but it's not taking over, that can give you that perspective that, can really help you to keep moving and see that things are going to be okay.
Oh, that's really good. Yeah. And, I always end the episodes talking about living with well, in your case, living with diabetes, helping others, because I always like to end on the light side with hope, because hope is really the mission of my podcast here. Because there is hope. There's always a better day. And you just summed it up right there. So those 3 tips about just how we can just kind of get our mindset shifted in a more positive, light-filled way is perfect. I really appreciate that, Mark. I appreciate your time today. You're such a value to our community. I recommend you, and I speak highly of you to all of my diabetes friends and clients. So thank you so much for being here. And let our listeners know how we can connect with you. And all this will be linked in the show notes. Your Instagram and your website, and where they can find the book and all that good stuff.
Yeah, so you can go to the diabetespsychologist.com is the hub for everything that I do. The podcast, the book. If you want to buy the book, you can go to the diabetespsychologist.com/book. Mm-hmm. You can also download it for free if you'd like at that website. You can follow me on Instagram at the Diabetes Psychologist. And yeah, that's the best place. I'm always happy to chat with people. So feel free to send me a message. I'm more than happy to help in whatever way that I can.
Awesome, Mark. Well, I think there's going to be some more listeners heading your way. So again, thank you for your time today. And maybe we'll have you back on another show. We'll see about that, right? Yeah, that'd be great. So everybody have an amazing day, and thanks for joining us. And until next time, bye for now.
Thank you for listening to the Type 1 and Midlife podcast. Head over to iTunes to subscribe, rate, and leave a review. It's very much appreciated. Thank you. And be sure to check us out at abundanthealthwithmelissa.com for our free resources. See you next week.